So today we have a patient who previously had silicone injected into her buttocks. She comes from out of town, out of state, and she's having a lot of symptoms in the buttock. Localized pain and some occasional radiation of pain down the legs. Every morning she wakes up, she has localized pain in the buttock, and she has some firm masses in the buttock. It's not completely widespread. There are not a lot of big nodules everywhere. She cannot cope with a larger incision. So today we're going with what's called ultrasound guided. That means I can use the ultrasound to find it. VASER-assisted. The VASER is going to help break up the scar tissue around the molecules. And then we're going to use a large cannula to suck out the scar tissue and the silicone. So today what we're going to be doing is called ultrasound guided, VASER-assisted silicone suction. So this patient has a moderate amount of silicone injections throughout the buttock. She does not have any really hard masses. She does not have any significantly large areas of silicone, but she has these little scattered areas of silicone throughout the buttock. So this patient, in my opinion, is a very good candidate for what we call ultrasound guided, VASER-assisted silicone suction. So what I'm going to do is I'm going to make 3 separate incisions, one at the top of the buttock here. I'm going to outline that in red for you. I'm going to make an incision in the bottom of the buttock, right in there in that fold and in that fold. And from those 3 points, I can access the entire buttock. So the first thing I'm going to do is I'm going to put in there my tumescent solution, which allows things to float. Then I'm going to use the ultrasound to find exactly where these silicone foreign bodies are. And then I'm going to use my VASER to melt the scar tissue that's around the silicone. The yellow is the scar tissue and the white is the silicone underneath. So the VASER is going to come in, this probe, and it's going to shatter all this scar tissue around the white silicone. And then I'm going to come in my final step, and I'm going to use a cannula or a surgical straw to basically capture that silicone, remove it, and then we're also going to suck out a lot of this granulomatous scar tissue. From the side, you can see she has some silicone balls there scattered, and a patient like this, in my opinion, is a very good candidate for the silicone suction, where we can get rid of a lot of the silicone injections as well as the associated scar tissue with silicone suction alone. So we're about to start, and the first thing we're going to do is put in tumescent solution. Tumescent solution is a solution that has epinephrine to minimize the bleeding and lidocaine to minimize the intraoperative as well as the postoperative pain. And she has early signs of silicone injection in the fact that she has a little bit of alligator skin here in the buttock crack as the silicone is trying to be ejected. It was injected here, and as she sits on the buttock, the silicone tries to come out through the skin here. Also, she has a pretty large mass right in here of silicone that needs to be removed. She did not want the larger incision across the top of the buttock, so what we're doing today is ultrasound guided to find the silicone. Then we're going to use the VASER to break up the scar tissue around the silicone, and then we're going to use suction to get rid of the silicone. And this is tumescent solution. This is a special type of cannula. We're going to inject here. This helps the VASER to work better. So you can see on the screen here, all these little white dots, those are calcifications from the silicone injections. That's basically early scar tissue that's setting up, walling off that really bad silicone from the rest of the body. So you can see the black little dots there, that's the silicone, and then those little white dots are the scar tissue surrounding the silicone. So you can see it's pretty prevalent around the surface of the skin. Now I'm going to look around the rest of the buttock, see those big black hollows with those echoes, those, I call them church bells, because it looks like a church bell to me at the top, and then kind of has a hypoechoic or a dark area behind it. That's all the silicone that was injected. This is mostly in the inferior third of our buttock, where we're going to concentrate our VASER. And you can see as we get towards the buttock crack, that there's a fair amount of silicone. See all those little white dots? That's all that silicone being kicked out there, or attempted. As we get to the top third of the buttock here, I expect some more. Those black hollows are the silicone. And so right in there. So not a lot of the distinct big bobas that we typically see when we do the open procedure. So when it's sort of like microcalcifications or micro droplets of the silicone in here, that's, in my opinion, perfect indication to do what we're doing here today, is to remove it with the suction technique. And then to further protect the skin, I use this very wet towel, just in case the port bumps against the skin, you can get a burn. This is our VASER. Okay, it's a ring device, it's a tube, and it's got these rings on it. You can have multiple different types of rings. I use this one, and basically the machine emits energy through here to the tip, and then at the end, it's ultrasonic frequency that shatters the images. That's, yeah. Very good. Now we're going to come in here and start to aspirate, suction, both the scar tissue and the silicone. So we're going to come in here where the VASER has done its job, and you can see we're getting very good results here. Just sliding through all the scar tissue with relatively minimal resistance because of the VASER. We get patients saying, oh, the suction technique doesn't work. Well, this at the end of my cannula is one of these silicone bobas. Okay, this is a ball of silicone surrounded by scar tissue. Okay, so look, the suction technique does work. There it is. So by removing that in the cannula, that is silicone removal. So I'm not just spreading it around, I'm actually removing it. So there's a perfect example of the technique working. Because this boba of silicone, look, goes down the tube and goes into the canister over there. So I'm not just spreading it around. So here's one of these silicone little bobas. I'm going to pop it. Look, it's full of silicone. See how it kind of leaks out like that? So that's a silicone, I call them bobas, or you can call them balloons, or whatever you want. But there's proof that this technique works. This is now soft and almost silicone free. A lot of the hard scar tissue is gone for this patient. It's no longer wrapped around the nerves in the back or the sciatic nerve in the posterior aspect of the pelvis. And now we're going to go ahead and do this. We use our ultrasound here, see what we can see. So as this aspirate, the liposuction material, comes through the canister, a lot of the silicone is percolating to the top. You see that clear layer? That clear layer of basically pure silicone from there to there. So all that's pure silicone, so you know, the statements I get, oh, you know, that technique doesn't work. Well, what's that silicone then doing in the bucket? So we're done here with our ultrasound guided VASER-assisted silicone suction, and very good results here. The majority of the silicone is gone, the majority of the scar tissue is gone, and she has a nice soft buttock, no scar tissue, and she's going to get a really good result. She'll now, a lot of her pain and associated buttock and low back pain and radiating pain down the leg is gone. So we're just going to slip her into her garment. I decided to put 2 drains in here. It's just going to make it an easier recovery for her. Probably in a couple of days, 2 or 3 days, we'll get those drains out. So thanks for joining us. That's how I do ultrasound guided, VASER-assisted silicone suction for silicone that's been injected into the buttock. So if you have silicone in the buttock and you have symptoms, or even if you don't have symptoms, I would suggest you get the silicone removed. So thanks for watching. Please join us next time.